So good morning, everyone. Thank you very much for having me today. I'm going to speak a little bit about the impact of COVID on health and human services organizations in implementing digital and data solutions. And I will start by saying a little bit what has happened during COVID, and then speak a bit more about the shifts that these has brought and what is going to come next and beyond what we are seeing developing today. So currently, what has shifted because of COVID? The COVID pandemic has exacerbated risks of vulnerability. Be it, of course, the physical health risks, of course, have been very much increased, but also there were risks put into the economic well-being. We had a lot of risks of abuse and neglect in the families because people were not outside as much as they were before, and we didn't have so many contacts. And there were many other risks that have developed in the framework of COVID. These risks have impacted all ages of population, all types of vulnerable population, going from the youngest to the eldest, and of course all the people with disabilities or disadvantaged in general, be it minorities or people with less revenues. Also, the COVID crisis has led to a worldwide disruption in the delivery of critical social services. Childcare, daycare, education have been the first one that were tackled. And of course, childcare education is something very, very important in order to provide a level of development and of a social stability to everyone. Also, there were, of course, a lot of disruptions in other kinds of services. And in general, you had, for example, in the US, a 56% of reduction in staff of all the institutions taking care of people at home, for example. So these are some figures, but we really observed this. We did a worldwide study, and this is something that has been impacted and noticed in most of the countries. All this has created new challenges to the whole ecosystem. First of all, there was a big questions of staff shortage in the different social services or public entities, be it staff missing people, at home care, for the at home care. Of course, in the hospital, you had a big tension of staff. And so it was very difficult to organize all this at home care, or in particular for dependent people and aging people, for example. Also, you had an important disruption in the services that could be delivered. There was a breakdown in all kinds of normal communications between the private and the public sector, which made it very difficult to deliver the service as it would have been delivered normally, let's say. We also noticed that the financing of the system, which is a lot based on charities, for example, or private investors giving money to support the system, since they were facing a lot of uncertainty regarding the future, they would be much more cautious into investing into the sector. And so also in some countries you have social impact model. The contracts are being paid on the base of social impact, and so these needed to be readjusted rapidly because the social impacts expected had to be totally changed. And finally, also, which may be the last but not least, as we would say, the schools had to change suddenly to remote learning with lacking a lot of preparation. And in general, the public healthcare systems were overburdened by the COVID-19 cases and therefore not able to support service delivery adequately. So in general, the urgency of this pandemic has been accelerating the transformation of social services in the sense of getting more personalized, more digital, more collaborative, and more outcome driven. And on this screen, you see that we have some existing challenges that are being now tackled or helped, let's say, by some technological disruptions. And we see a big shift in the way these services are used. So, for example, when we look at all the social sector is faced by budgetary constraints and also by a lot of siloed organizational structures. In general, you have social services, then you have education services, then you have health services, and these siloed structures make it very difficult for them to communicate between each other and to share information in the sense of the person. Today, and thanks to COVID, intelligent automation, artificial intelligence has been coming a lot in order to try to bring more this citizen-centric mindset to the organizational cultures of the service providers. So this is a first very important effect that we are noticing. Then you also have a lack of digital skills, a lack of data-centric culture in these organizations, a very low or little community management. And also here we have augmented reality, virtual reality, the Internet of Things that is helping a lot through robotic process automation, through predictive analytics, to try to intervene better, earlier, identify the situations, and provide help and support as a complement to the human support, of course, which is fundamental. But we can help out when the humans are not enough there or cannot be there, or to try to be there before things turn to worse. And then we also have a lack of evidence-based thinking. And here again, predictive analytics can help us, and also platform computing, in order to try to design better the policies based on what are the effects that we have been noticing of this or that kind of support and intervention? What is the social impact of all these investments we are making? And what are the support services that bring the most results? So what's next and what's coming up right now? As I said, the citizen-centric mindset is really transforming how social services are designed and delivered. So I don't want you to feel that there was no citizen-centric before. It was a purpose, but really COVID has exacerbated this sensation and this need to be more citizen-centric. The entities now can offer more accessible and more personalized services with a better integration across the different service providers and the different IT systems. And this makes it, COVID has enabled to develop digital platforms to help citizens to better understand and navigate through the social services, through their entitlements. They have also, governments are trying to tailor the information and to make it, to send the adequate information to the person when he or she needs it in her life, depending on the events that happen to him or her in her life. And so that is something that has really made big progress during this COVID pandemic. That has accelerated. Also, it has developed a lot the hospital in the home, or the hospital at home model. This is, of course, a model that has been developing in the past years, but it was mainly before for interventions that were very low, with a low severity. During COVID, this has accelerated because it was a necessity for people who would otherwise need to be in hospital, and where there were no places for them anymore, and because it was full of COVID people, for COVID patients. So the idea of this hospital at home model is really completely to have the people stay at home as much as possible, but with technology, but also with the people, with the workforce. It enables to intervene in the people's house when it is really needed. And it enables to have a control model and a control support that everything is fine and that your constants are fine. But then when the clinician, when the nurse needs to come, or when you need a specific medication, you have an alert and someone can deliver it to you directly to your home. In general, we notice also that there is a move towards building a patient-centric smart health organization based on the smart hospital. I will not go here too much into detail, but there is this idea that tomorrow our hospitals are going to be more intelligent, more human-centered, very connected between themselves in order to identify rapidly the situations, and with a high reliability, but also sustainable, because this is also something that is a lot expected from our populations. So if we look at the beyond and facing more specifically on what is going on in social services, the digitalization of social services is going to continue to accelerate beyond the immediate crisis that we have noticed. This digitalization of social services is really transforming right now how agencies and employees work, collaborate, how vulnerable citizens are engaging with the service providers, and also how all these services are targeted or delivered to those in greatest needs. What we have noticed and what is developing right now is, for example, RPA. So this is robotics process automation. So the fact that you have a little robot to help you in social services. This is really helping a lot in administrations to be more efficient and to dedicate more time to the more complex situations that cannot be dealt by a robot, but where you really need the human intervention to solve a situation. And also it is possible to better the situation, for example, at home, having the intervention of some robots to try to entertain the person, to deliver some services. This is really being developed as a complement to the people's intervention. And so this developments is really these intelligent robots, these cobots who are assisting with physical, social, cognitive tasks, and who are being developed right now very rapidly. Then there is also a strong development of artificial intelligence and intelligent automation. And all of this has been dramatically expanding, and it's creating new opportunities in social services in order to really support people with vulnerabilities. But we have to be very careful at one thing in particular, is that this rapid technological development, it is important that we make sure that the people stay connected and that they also understand what these new tools can bring to them. Also, with these rapid technological development, with everything we know about big data, predictive analytics, all these have proven their place in anticipating risks to vulnerable people and intervening earlier to prevent harm. And here EY has been very active into developing a vulnerable person platform that is enabling, based on the fact that we have a complete view of a citizen. So a view of a citizen based on data coming from the different silos of administration, be it social sector, the health sector, the education sector, for example. You can make all these data match and merge to try to identify some risk situations. And when you identify these risk situations, you can propose an early intervention based on evidence-based solutions, and offering these evidence-based solutions where you can have this track record of, if I provide this service to 100 families who are in that situation, in that risk situation, I know that I have an 80% chance that their situation is going to get better. Whereas if I don't do it, or if I offer another service, I have another percentage of chance of bettering the situation. So this is very interesting to adapt the intervention. And also it is very interesting to adapt the social services, the public policies that are developed in order to adapt best to what is needed by the population. And we have to understand that a prevention focus is much better than acting into the crisis when the crisis is already there. Of course, it's much better for the person. You have a better chance of recovery. And also you have a better, it costs less for the administrations. So here I would like to stop and show you a little video. We have a lot of case studies that are available on our EY website and that you can find here around how these predictive analytics have helped us in preventing some situations. And I would like you to watch very rapidly this video from the London Borough of Barking and Dagenham, who is going to tell you how technology helped prevent homelessness and how it helped them also identify people in risk situations during the COVID crisis.
Organisations across every sector are waking up to the transformative power of data and analytics. Health and human services is one sector that can truly benefit from adopting this power, as data and analytics solutions can not only improve service delivery, but also transform the lives of people in their care. EY has collaborated with Imperial College London's Institute of Global Health Innovation to explore how 5 health and human services providers each used groundbreaking data and analytics solutions. Their report profiled 5 compelling case studies from around the world. In 2019, the London Borough of Barking and Dagenham was one of the most deprived areas in London. The council wanted to address the challenges of endemic unemployment, poverty and homelessness by connecting residents to the right help and support in a timely way. However, information on households was often stored across different case management systems, making it difficult for caseworkers to have a comprehensive view of their residents.
So for too long, our residents have faced a legacy of really poor outcomes. And that, coupled with the challenges of rising demand and financial pressures, led us to a position where we wanted to think very differently about how we could better respond to address residents' needs.
Collaborating with EY and Xantura, the council implemented OneView, a data sharing, data management, analytics and predictive modelling platform designed to provide a single holistic view to caseworkers of families or individuals in need of support.
And the problem we wanted to solve is really complex. So why were EY the perfect partner to support us for residents? Well, we wanted OneView to enable them to tell their story once and to be supported to access services and support at the time and the place when they need it. And we also wanted our staff to be able to benefit from having access to data and information at their fingertips.
The data and insights available through OneView have already helped the council reduce the use of temporary accommodation, leading to significant cost savings. The platform's comprehensive overview can also help better manage demand for social care and identify those most at risk before a problem becomes a crisis.
And it's also supported our response to COVID. For example, we've been able to predict over 90% of people who were most at risk from COVID in the borough and to connect them to help and support. And we've been able to do this a lot earlier than we would otherwise have been able to do so. So in total, that's well over 8,000 residents helped quickly.
Each case study shows how health and human services organisations are improving patient outcomes around the world today. The pioneering work of these early adopters will help shape the long-term future of the sector and its use of data and analytics. At EY, the highly integrated services and solutions make us well positioned to help organisations embark upon this journey and help shape the future of health and social care for the better.
So no, I hope you were interested in this video, and of course I'm available for any questions. There are a few last ideas I would like to give you. What we are seeing that is being developed also is the citizen-centric services are going to be restructured around these critical moments in a person's life. And this is really something that we are observing in many countries in the world, with the fact that governments are trying to offer services that go from the birth of the person to her aging, to her very old age, and trying to deliver the most adapted supports at every age of this person. And so the goal is really to consolidate social services across different providers to provide all these push notifications to the citizens when they reach a specific moment in their life. When they are in the first ages, when you need to do prevention in health, for example, when you are expecting a child, when you are getting your first job, when you are then maybe getting older and needing some prevention measures. So for example, here is the application from Singapore. It's called Moments of Life. And this is a mobile app as a suite of services to provide with an easy access to seniors, to parents of children, for learning about benefits, finding programs, healthcare near one's residence. So Singapore is the integrated version, but what we observe in the world is that you have a lot of small dots developing in the different parts of the world, in the different governments. All of that can only work if we have a unified, secured digital identity to access all these services across the agencies. And so we need to link individuals across organizations, link digital IDs in order to try to have this unified version of the person. As I said before, this is absolutely fundamental, and we are going there. We have to be very careful in that time that we don't accentuate this digital divide with the population. So this is why I focused here my intervention a lot on what is changing through COVID, how it is innovative, how the technologies are improving. But of course, the link to the people who will be there to support them and to make all these services work is absolutely fundamental. So that's all for me. You will find all our key contacts also and the links in the presentation. And I hope you enjoyed it. Thank you very much for listening.
Jessica, thanks for your insightful sharing. So let's look at our online audience questions. So you introduced the hospital at home model with the adaptation of telehealth and remote patients monitoring. Would it be just a shift of the demand from hospitalization to staying at home, or would it create new demands to the healthcare system? So what do you think, Jessica?
Well, the idea indeed is that it is a shift and that it tries not to reload more the healthcare system. The idea behind that is that people can stay at home and not come to the hospital, don't have to wait too long at the emergency room, whereas they should be going into a service. So the idea is that it is a shift. Of course, every time you create a new service, you create a little bit of inflation of demand, but the idea is really to change it, to shift it.
Right, so we always look for new experience, right, and new service. So the second question, you highlighted applicable technology in this digitalization of social service, such as robotics, AI, automation. So how ready is the social service sector in adopting these solutions? And what are the challenges, do you think?
Yeah, it is a very important question. What we are seeing is that indeed the social sector is one of the, let's say, less advanced in digitalization, more or less all over the world where we are working. But there is a wish to go towards this digitalization. This is led by two activations. One is that actually the people are more and more connected, and they would like to have their meetings on their phones. They would like to be able to connect with the social workers on a different way than just on a physical meeting, having to go to their office. So there is a demand actually from the public and even from the people in the social services for this kind of service. And then also, of course, COVID has changed a little bit the practice of working and using data, IT tools, and it has been a big change also in the social services. So we have now, let's say, an opportunity from this crisis to try to work and develop new technologies and new tools.
Thanks. So the third question is about examples were given on use of data management and predictive analysis. What are the skills or tools needed for the next generation of social workers and social service agencies? Do you think, Jessica?
There is a big work to do on clarifying and cleaning the data that actually the social system already has. So there is a first step, which is to say, let's not try to do everything. We cannot start with everything. We cannot clean everything. Let's choose a topic. So you saw the example from Maidstone. They worked on the expulsion prevention. We have other examples where we work on child protection. So each social organization can choose a subject on which it would like to start, cleaning the data, and then working on a complementary digital service offering that is a real help for the social workers in their daily work. And if you make up a tool that brings help to the social workers, then you will see that they will be interested in having data that is better. And so in implementing, in giving interesting data into the system. So it's a virtuous circle once you try to put it on, because then you will see that actually the data is really able to help you, and that the IT tool is not just an extra burden with an extra file that you have to fill in.
Exactly. So, maybe I'll pick this one. In your experience, how ready is the practitioners in adopting machinery predictions compared to traditional approach of social work in understanding the community and individuals?
That's a very important question, because I don't want you to misunderstand what I was saying. It is not, machinery predictions is not saying what is going to happen. The idea of this tool is just to tell you, these are the different possible cases, and these are the different solutions, service offering that you as social worker can choose to use or not to use. So it is not replacing in any case the approach of social work in understanding the community and individual needs, as you say, not at all. It is just an extra tool for the social workers to have in mind, okay, I know that in 80% of the cases that were more or less the same before, we were able to use this solution and it made a positive success. When we used this other solution, it had a success of 20%. So am I going to propose this one or that one? It's up to me to decide, because I know the different solutions, but I have them in front of me. Also, we often have the problem that social workers don't always have everything in mind, because what they have to cover is really, really very broad. So knowing all the services that are possible, all the active people, you have social workers coming from one territory to another, moving, etc. This tool is to facilitate their work in telling them, here is what is possible. Maybe also a reminder, there is also that can exist for you, but then the social worker is working with the person, with the family, on choosing what is best for them.
That's so true. Thanks so much, Jessica. You're right that social workers are dealing with so many possibilities. So it is a tool to remind them what are the possibilities that they might have missed. Thank you, Jessica.
Good afternoon. First, I would like to thank the kind invitation of GIES 2022 to be present here and be able to be discussing with the participants in Hong Kong and in other places of the world the European experience of the use of digital solutions and assistive technology in the post-COVID era. So I hope you enjoy it, and I again thank the invitation to be here with you today. So very briefly, I come from Portugal. I'm the CEO of an SME called SHINE to Europe, and we work mainly on societal growth, inclusiveness, and we try to foster changes and advancements in policy through social innovation, ethics, and research. We currently have several projects ongoing, a number of them which are targeted at adult training and education, and that is trying to promote that citizens have better tools in terms of literacy to be able to progress and participate in citizenship and democracy, and also to foster for better health, social care, and well-being. Apart from this more educational projects, we also work on a number of Horizon research projects and networks, mostly more connected to social innovation and to promoting broad networks of stakeholders, either researchers or citizens, NGOs, and others, that come together and discuss how to contribute for more inclusive societies. One of this, some of these networks, namely Net for Age Friendly and the Schaaffe Foundation, are shared by myself and mainly a colleague from the Netherlands, Willeke van Staalduinen. And we now currently gather almost 500 researchers and other stakeholders from 51 countries. And the main aim is to progress on what we call the smart, healthy, age-friendly environments. This concept came to discussion some years ago. It was around 2017 after a number of different projects where we were involved. And one of them, which I very well recall, was a robotic project where we were developing a social robot to be at home with older people to make some companion and also to support people in their daily tasks. And in the course of the project, the robot was actually being very well accepted and was being developed well. But then, for example, in Portugal, it was very difficult to have it in the house of older adults because most of the homes were either too cluttered or had many stairs, or the different spaces in the house were not that big or not big enough for the robot to walk around. And then we were thinking, we are investing so much in technology, and so often this doesn't work for other issues. In this case, for example, for the building environment. So this should be better aligned. And this led to this discussion that if we are all promoting that we should be in our communities and live and age at our homes, we need to align better technology, the building industry, and of course, social care and health, both in terms of policy and funding. And this was the beginning of the stakeholders network on SHAFE, which is Smart, Healthy, Age-Friendly Environments. So as I was saying, in 2017, this concept arose, and we proposed it to the European Commission that approved it as a thematic network. It was actually very interesting because so many organizations considered this was making sense, and that health, social care, built environments, and technology needed to be discussed together and not separate in silos. So at the end, we delivered a joint statement to the Commission and to all member states and gathered a lot of support, explaining this, that there was a need for this shared vision where different aspects are discussed together, and we need to cooperate, foster research, have conditions for implementation, and empower citizens to be able to have real inclusive societies that promote health and well-being. With the pandemic, a lot of things changed, and this introduction was a bit to say that all of this is somehow aligned with what is now the post-pandemic scenario. So many things were developed during the pandemic in Europe, of course, also in other continents. Some of them works very well, and some were perhaps less efficient, depending on different conditions. For example, the digital COVID certificate was something that worked very well. It was accepted in all EU countries, and it was a good way to be able to have the right conditions for people to have mobility, to go between countries, to go to the restaurants or to hotels, and to be able to have some confirmation of their vaccination or health status. However, for example, at the same time, the tracing apps that were developed were very differently implemented in countries. So, for example, in southern countries like Portugal, with more mistrust in how governments manage this kind of technology, they were really not very used. However, if you go for northern countries like Finland or Norway, most people use them. So technology is not efficient by itself. It depends on different innuendos and conditions, contextual ones, also connected to culture. In terms of digital health, of course, that the pandemic made a huge difference and accelerated the implementation of teleconsultation, of digital apps, and also of different ways of replacing face-to-face with other possibilities. This range for health solutions, smart solutions, also, of course, mobility, housing, and outdoor spaces and buildings. For example, products and services for age-friendly housing were very much developed during the pandemic, and they were accelerated because so many of us started working from home and had to spend more time in the house. And this implied that people needed to be accompanied, monitored, and taken care of in the house. This is an example of a telemonitoring system that was implemented in Portugal by our health service, and that is supposed to be installed in the cell phone, and the person who uses it is accompanied by different professionals in order to understand the health status. That was simple, telemonitoring, but there are a lot of other complex situations. And for example, social robots were also somehow accelerated in the market because of the pandemic needs. Other possibilities, for example, this is the Blackwood homes have fostered even more the idea of a house that moves as you need. For example, in this case, the cabinets, the sink, the refrigerator, everything in the house moves to be adapted to your conditions. For example, in this case, they can come down for someone who is in a wheelchair. And this is also a way to use technology to be able to promote the possibility of people being autonomous at home. In terms of social care, this is another example. CleverCogs was a system used in social care organizations where people were, during the confinement, with no possibility of having caregivers in the house, and they could communicate through the system. Different possibilities, for example, in Vizcaya, these apartments were already thought of before the pandemic. They are supposed to be completely accessible and having different services that are promoted in the buildings to support people who need some kind of special care. And similarly, in the Netherlands, Easy Homes, besides the question of accessibility, also have a number of smart technologies installed that can support older adults during their stay at home, for example, even having direct conversations with caregivers. So many possibilities were now, well, they existed, but they were now considered as much more needed to be implemented everywhere. And besides being supportive, also a lot of connections with climate change and energy consumption were now also brought up by the recent Ukrainian conflict, that implied that we also consider even more the environmental sustainability and the consumption of resources. This is, in this sense, it is interesting to say that there are initiatives such as Homes for Life, which was an European project, where the idea is to certify the smart houses or the smart environments that can help people to be supported throughout their daily living, and that engage the 6 different areas: physical, economic, personal, social, outdoor access, and management. And all of this is essential to ensure that whatever type of support we are providing is holistic and is integrated in all different aspects of life. Because it is very crucial to say that although digital tools, internet, and all different kinds of digital solutions were so much increased by the COVID-19 outbreak, the truth is that we still have a big difference between the good and adequate use of internet between younger and older generations. And this is clearly seen here. For example, even in terms of report of use and not really quality, if 98% of those aged below 24 years of age were using the internet, only 61 aged after 65 were using it. So when, for example, we consider that there were a lot of health and care services that passed to digital, then we are almost at half of the population who may have difficulties in using them, and this is important. In this sense, the EU level is still not that high. And for example, if we go for the Portuguese case, which is mine, even lower than the EU average, we still need to invest a lot to ensure that the digital tools can be well used by older adults. And besides age, there are also other very important and relevant areas that we need to consider. The question is that the type of income, the place of living, and even the literacy influence the use of digital tools. And if we really want to be inclusive, then we need to acknowledge that the digital uptake needs to consider a number of different aspects. So, of course, digital skills and health literacy are very important, but also, of course, less inequalities in access and more engagement are necessary. But besides the literacy and skills part, also environments have several challenges, and we need to retrofit so many of the houses. We need to give better mobility solutions in public spaces, and of course, consider the climate aspects. And in terms of health and care, we have in Europe a lot of different solutions, products and services, but they are still not fully integrated in terms of a person-centered pathway. There are still a lot of differences between member states in terms of funding solutions. Some of them are dependent on insurance, others are dependent on health systems, national health systems, and this also influences the way that new solutions, especially digital ones, are integrated. This all background was the reason why we developed the network Net for Each Friendly, which is currently funded by the COST program, which is a program mainly aimed at collaboration between different stakeholders and countries. This is usually more a research program, but our idea was to promote a quadruple helix participation, that is, having academics and scientists discussing these issues with businesses, with caregivers, NGOs, public authorities, and citizens. And as I was saying in the beginning, we currently reach 51 countries discussing age-friendly environments. So the idea is that we can support different countries to promote the establishment of local or regional ecosystems that work in this area of connecting health and well-being to an inclusive digital world. And for this, we have different working groups and different aspects being discussed. One of the things that we think is crucial is that there is this holistic approach on the physical and mental development of adults. So we try to avoid considering only promoting inclusiveness and solutions that reach older adults, but instead we try to go through the whole lifespan and promote this development that starts already with the child. So the idea is that if you put all of the different stakeholders working together, and if you develop skills that promote healthy lifestyles at all ages, then it is probable that throughout the life course, you'll also be able to respond better to challenges, to difficulties, and that you also understand what you need to keep autonomous as much time as possible. Of course, this is only possible if you have lifelong learning, which means that different people need different things, and we need to have very targeted and diverse literacy measures for different age range, for different publics and audiences. And for example, right now we have a lot of investment on digital tools, but perhaps we need to use also traditional media and other tools to foster digital literacy, because it is still not enough for people to go completely digital now. And all of this only makes sense if we also consider all of the other environments where people fit. For example, the question of income is still a big issue to increase digital literacy, because you may provide the skills, but if people don't have enough resources to be able to move around, go to services, or even to use and buy the digital solutions, then nothing of this works. We foster and stress the need for a human-centered design approach in terms of policymaking, which means that one size does not fit all. We really need to understand what are the challenges for different people and find ways of promoting potential solutions that will make a difference in that specific person's life. At this point, we are still so often promoting services and products for people that are already at an old age, but sometimes we forget that even younger people may not be duly prepared now to deal with a technological world in 20 years or more. So the question of personalizing the environments and personalizing the type of skills and literacy we provide to citizens is really key to possibly have a different future. The idea at the end is that when we advocate for smart, healthy, age-friendly environments, we think that people should not need to adapt to environments or solutions, but we should propose these as something that grows with the person, includes different types of needs, adapts, grows, and responds to the personal needs of each person at any age or condition. If we can do this, then in truth, we are promoting a continuum, and it is for sure more inclusive and less prone to raise new challenges. So this whole agenda after the pandemic means that we consider we should foster health being discussed together with social care, with digital solutions, with more accessible environments and housing, and of course, with people and the community at the center being empowered and able to discuss what they think they need and how can we progress for a better society. Because at the end, it's all about people. Thank you. I hope you enjoyed it, and I'm fully open to answer to any questions that may arise.
Thank you, Carina, for sharing your experience in Europe. So let's look into our online live chat room for the questions. So the first one, you shared that the acceptance of technology, for example, tracing apps, was different among different EU countries. So what would be your suggestion to address cultural or acceptance difference cross-region technology collaboration? Carina?
Well, thank you for the question. It's very pertinent. I wish I had a reply, but I'm not sure if there is a simple reply, because it's very rooted indeed in terms of cultural issues. I do think that if we bring technology to people in a more explainable way, if of course digital literacy is increased and most citizens understand what is behind the different technologies, and especially how the data is stored, how it's used, who will have access to it, this may increase the possibility of having better acceptance or adoption even. But it's still a long-term process, I would say.
Yeah, I believe so. It's a really long way to go. Okay, so our second question. In your perspective, what are the critical challenges and key success factors in driving collaboration between the tech sector, building industry, and the social service sector? What do you think, Carina?
Well, I think that on one side, of course, communication and collaboration are key. I mean, people need to know a little bit more about the other areas of work so that they can understand the challenges. So multidisciplinarity, especially multidisciplinary teams, people that broaden their own knowledge through long-term training and lifelong learning. Of course, this will enable it a lot. But at the same time, we also need to have policy streams that are concerted, that are more holistic and not only focused on different silos, which is a lot of what happens still. You have a Ministry of Health that deals with health, you have a Ministry for Social Services, you have a different ministry for urban planning, for example, and we need more collaboration between the different ones, perhaps with policy task forces, or having we don't mean, of course, to have too many more public streams, but of course we need to have something that puts them together and makes them talk to each other, even at the policy level as well.
Right, there are really many different stakeholders to include. So to the third question, are the networks you mentioned mostly focused in European countries? And are there any opportunities where Asia-Pacific stakeholders, like Hong Kong, could participate?
Well, for example, in the case of Net4H Friendly, the cost action that I mentioned, we do have partners from all of the world. We have partners from Japan, from China, Australia, Canada. So sometimes the big issue is that the funding that is available, for example, to participate in meetings is restricted to the cost countries in this case. But it is possible to apply for funding directly in the country. I would imagine eventually also in Hong Kong, to be able to come to Europe and share initiatives with us. So this is quite open, and I'm happy to share the links to the application, which is free and voluntary, in case we have Hong Kong partners that would like to participate.
That's a really good news for us. Thank you, Carina. Okay, so before you go, may we have the last question? In your opinion, what are the strengths and potentials of the European region in promoting development and adoption of technology for active aging? And how could the European region maximize its strengths in contribution to the global aging agenda? Okay, it's a long one.
It's a long one. I'm also trying to read it, to try to position a little bit. Well, in terms of Europe, I would say perhaps the strengths and potentials lie in the fact that Europe has a lot of different countries working together under the chapeau of the European Union, which of course makes it, let's say, in one way, we have all of the differences that we discussed before, also the cultural ones, but then we try to find some possible common ways. And this implies a lot of compromise, and at the end possibly enables a bit more that things can progress with a common agenda, which I think, of course, is a plus. And in terms of the European Union programs, we have been having a number of them where, for example, Asian-Europe cooperation is promoted. So this can mean that we can then try to exchange as much as possible the place where we got to be at in our own continents, and try to exchange it and find for commonalities that allow us for a common agenda. So I think this is possibly the cooperation between different continents is really important for us to progress. I learn a lot every time I talk to Asian partners, because there is a different history. Things were achieved in a different way, and that's very enriching, because some of the things make us rethink again of how we could be doing things and how much we could be progressing if we talked more to each other. So I think that the strengths are mutual, and the way forward is to collaborate more so that we can learn from each other and progress faster.
Right, learning from each other and make us all rethink again sometimes is really important, right? So thank you so much, Carina, again, to have you with us today.